Hello and welcome to Aesthetically Speaking. Functional medicine is steadily gaining traction in the global health space, offering a more personalized, preventative approach to care. But what does that actually mean for patients? And how does it differ from conventional medicine? Today I'm speaking with Dr. Simone Silver from the Hormonal Health and Wellness Centre, where a multidisciplinary team focuses on root cause medicine, hormonal health, and long-term well-being. Dr. Silver, thank you so much for joining me.
Thank you very much for having me.
Let's start with the basics. How would you define functional medicine, and how does it differ from traditional Western medicine?
So I actually would love the narrative to change from functional medicine and traditional medicine being these two different things. In fact, they should bridge and they should overarch. But basically, functional medicine is a slightly different approach, a conventional traditional medical approach, which is what I was taught in medical school, is to really view health and lack of health as a state of disease. So as medics in training, we're trained to look out for symptoms of disease, diagnose disease, and treat disease. We're not really taught how to preserve health, how to handle health. What does health actually mean? So, when we ask these questions of our patients or our audiences, what does health mean? It has different meanings to different people, which really illustrates the point that health is personal. It's personal and means different things to different people. So the philosophy is slightly different, but I think that what we're seeing is the conventional medical space is evolving and is going to embrace this. What I would like to emphasize is that functional medicine should be science-based. So it should be drawing the best of the science and the research that we have, which is very much where conventional medicine gleans its principles from. So those principles of science-based should be the same. But again, it's just a different thinking style, a different approach that is more personalized, a bit more integrative. It embraces connecting the dots. So in traditional medicine, we sort of taught to think about body systems in silos. We think about the cardiovascular system and the gastrointestinal system. In a functional medicine system approach, we would look at how these systems actually connect.
All right, so can you explain then what's meant by the system of systems approach?
Absolutely. So that's a beautiful biological way of thinking about functional medicine, which is the body is a system of systems. They're all these systems. You have a musculoskeletal system, a hormonal system, a cardiovascular system, but they don't operate in isolation from one another. They are completely interconnected. And that is not how we are trained. We're trained to think in a siloist way. However, any medical doctor or practitioner would tell you when they start to practice medicine that patients are not textbooks and things really occur in isolation. So we often prompted at some point in our careers to think a little bit differently. So for me, exploring these connections between systems over the course of my career has been absolutely fascinating. And there are many, many examples. So we often don't think about the gut, for example, being connected to hormones. What is that connection? But they're intrinsically connected. So we have a little system in the gut called the estrobolome. It's a bunch of bacteria that help us break down and recycle our estrogen. And if our estrobolome is not happy, it can affect our hormonal health, as one example.
So everything is really connected.
Everything is connected.
Many people are so used to standardized treatment, isn't it? One condition, one solution.
Correct.
But in your view, why is it then important to look at health through that individualized lens instead?
So I think we also have to understand that we need to look at health through different lenses depending on the situation. So if someone is acutely unwell, if someone's having a heart attack, that standardized care is very important. It's there for a reason. Everyone gets treated in the same way because we don't have a lot of time. We've got to save a life. And there's a discipline in training to make sure that we can save lives with that kind of care. So in that situation, it's entirely appropriate. But when we're looking at chronic diseases, long-term diseases, when we're looking at preventing diseases, when we're looking at aging healthily, when we're looking at someone who's not sick or not diseased, but doesn't feel well and they can't put their finger on it, this requires an entirely different approach that needs to be individualized and personalized. Otherwise, we're not going to see the fullness of the change that we might want to see. We have to take into account not only the biological differences between people, but their lifestyle differences. What works for one person and what they're passionate about and how they like to move and how they like to eat is very different to another. And if we give stock standard advice, it often doesn't work. So, in days of old, our doctors used to say to us, don't eat salt because you've got to preserve your blood pressure, and don't smoke. And that was the lifestyle changing advice. But patients don't listen to that. Why? We've got to dig deeper if we really want change.
So let's talk about the patient experience. If somebody walks into your centre for the first time, what can they expect from that initial consultation?
So we follow a two-step consultation process, which means that we see our first patients for an hour and spend that hour really getting to know them. We take a very thorough medical history. We get a really good idea of health goals as well and where the patient sees themselves would like to be in terms of their health. And then based off that consultation, we may recommend some testing. And then we bring the patient back once we've looked at the blood results, once we've assimilated the blood results, and we feed back a kind of assessment in the second appointment. And then we would start to talk about treatment strategies and tools. And I say strategies with good reason, because we would pull from multiple things to develop the right strategy.
So let's talk about diagnostics then. What kinds of tests do you offer at your centre, and how do they help guide a more personalised treatment plan?
Well, I think off the bat, I'd probably just like to say that sometimes over-testing is quite heavily criticised, and I think we do need to bear that in mind because there's a cost factor, and we want to be sensitive that we don't want to prohibit this medicine from people because of the cost factor. And I feel that with experience, we can actually find ways to test less in a way that's far more cost effective. And I often say to my colleagues, the most important thing before any expensive testing is to listen to the patient, because the body tells a story and we've got to tune in and really listen first and foremost. The tests are merely affirmative, really. So we can run blood tests, we can run some stool tests if we want to, we can send for genetic tests if we want to. And we might, in certain cases, explore deeper testing, more functional medicine testing, which looks at hormone pathways and organic acids, for example. But the testing really depends on the patient's appetite, the kind of information that's needed, and must be cost sensitive. I don't feel that it's acceptable to run every single test on the face of the planet for every patient. It's not the best approach.
I'm so glad you're sensitive to that, especially in today's economy. And also the listening factor is so important. How many times have I heard my friends say that they're just not listened to? And this is very important. And doctor, we often hear the phrase, prevention is better than cure. And from your perspective, is there truth in that?
Completely, absolutely, without a shadow of a doubt. We can prevent. We absolutely can. We know that we can slow down plaque buildup in the arteries, which can protect us from heart disease or stroke. We know that we can preserve joint health and bone density to protect us from the hip fracture that may happen in 20 years. There's so many examples of what we can do. And I think to take a step further, that we're often intimidated by the idea of prevention, and that we feel like we may have to change our whole lives around to achieve it, and we don't. It's in the little decisions, and one or two small decisions today can have huge health impact in years and years to come. So again, prevention is possible. It's not difficult to achieve. It can be achieved really simplistically. Far better to take that approach than to deal with crisis medicine and crisis disease when it hits. Absolutely.
And even with preventative care, could play a part in reducing the risk of like major conditions, like you mentioned, but like cardiovascular disease and arthritis and maybe even dementia.
Absolutely. And cancer. So all the chronic diseases, lifestyle choices play a role in so many aspects of preventing chronic disease and keeping inflammation low. So we know as we get older, the body tends to become more chronically inflamed. And we know that that's not a fait accompli. It's not a cast in stone thing that we're all going to go through. We can fuel the fire of inflammation or dampen it by way of our nutritional choices, our lifestyle choices, how we manage stress, what we do with our hormones. So these are important things.
Your centre brings together a range of specialists, and this appeals to me. How important is that collaborative, multidisciplinary approach when it comes to your patient outcomes?
Absolutely, it's critical. So health is a three-dimensional thing, and teamwork and collaboration for me is so important if we really want to create that holistic care. It's like looking at a diamond. Each patient has so many facets. And if you have just one practitioner looking at one facet, you're going to miss all the other pieces. So the more eyes you have, and it's also interesting because the more I practice medicine, the more I realize that there's actually truly an art to it. We're guided by the science, but I often speak about the artistry of medicine. And that artistry is very much in how each practitioner views the person in front of us. So we all see different things, and there's such beauty in collaborating in that information and getting input from different knowledge pools. Medicine, from a science point of view, is extremely vast. So one person cannot know everything. And when you've got many minds coming together, it's just truly magical.
Yes. And then genetic testing comes into that. And this fascinates me. Understanding your genetic makeup meaningfully, it can shape your preventative approach to health. Can you just unpack that a little bit?
Absolutely. So I feel what we must understand about epigenetic and nutrigenomic testing is, number one, this doesn't mean that this is happening in your health right now. So for example, if we get a test back that says you're prone to high cholesterol, it doesn't mean that you're going to have high cholesterol now. We have to understand that it's just the potential of your health and where your body may lean in going in terms of health directions if it's encouraged to do so. But the beauty and the value of having this information is that we can make different choices and we can get more specific with our choices. So we can start to really look at things like, rather than saying, I'm going to limit fat in my diet, we can say, well, what type of fat and how much fiber? And we can get far more nuanced about it. So there's definitely a place for it. But again, I would just encourage people to recognize that this doesn't mean this is what's happening in your health now. And also just to recognize that these genes are what we call, they're soft genes, meaning if you have a bad gene or a scary gene, it doesn't mean you're going to get the disease. We can switch on and switch off these genes. So the experience of this kind of testing, in my mind, should be absolutely empowering, not scary, not disempowering. So I think how the results are explained to patients and that process of care and containment is extremely important.
Yes, and there's some sense of control then, taking the control and doing away with fear and ignorance.
And I think that is actually just such a powerful health message. It is about us taking control. It's about patients becoming the captains of their own health ship. Very different philosophy to medicine in years gone by, where the doctor had the power and it was very paternalistic and the doctor would tell us what to do. We now want partnerships with our patients, and we want patients to feel empowered that they can shift and recreate their health journey and canvas many times over with guidance.
Lovely. When it comes to the more complex cases, because there are the complex cases like autoimmune disease, chronic conditions, taking this approach that you've so beautifully explained to us, what kinds of outcomes have you seen in patients undergoing this?
We've seen many, many different kinds of outcomes, and generally very good, because if you take the principles of holistic care and really taking care of every aspect of the patient, it would sort of be common sense that the outcome would be good from addressing health in that way and meeting a need how it needs to be met. But I think I would kind of just explain it to you that, if we have a patient with a chronic disease or an autoimmune disease, we would never disregard conventional therapy. So we would completely include that. But integrating with that, adjoining with that, some more thoughtfulness around health and health connections with a functional medicine approach is almost like giving the artist a whole palette of colors. So instead of giving the artist one paintbrush with one paint color, there's now a whole palette of options that we can draw from and use. So it makes sense that it's taking the basic framework and just expanding. It's not choosing either or. And I'd love this narrative to shift around choosing conventional medicine or integrative medicine. They need to merge in a responsible and successful way.
Yes, and I love that analogy of the artist painting, and we have to also remember that each of us is unique, so each portrait will be a unique one.
Love that metaphor, absolutely.
Now, I'm quite passionate about this renewed global conversation around hormone replacement therapy that's come about in the recent year. In fact, has this shifted how doctors approach HRT in practice?
Absolutely. I must just say that I have had the absolute privilege, and this has been just the pinnacle of my career, to have started addressing hormone replacement and menopausal issues some 14 years ago when we were still kind of in the dark ages of HRT, and then watching and observing how the science has evolved and how the narrative has changed. And fast forward, last year, the FDA removes a black box warning around estradiol replacement. And the sheer beauty of this for me is just to see how we can evolve and how we often as patients, and in this case as women, we needed to drive the change. In any science, change takes years. You've got to prove it and prove it and prove it again. And it's hard to turn those old wheels. But I have found that over the years, it was women who were asking the questions, who were advocating for themselves and their own health, and who were asking basic questions like, and I remember having this thought in medical school as well, like we were taught to know hormones as being all the same thing. So all progesterones are the same, all estrogens are the same, and they're not. It's like saying, well, all hormones are fruit. But you have bananas, which are yellow and taste very different to apples, which look different and taste different. Hormones are different. And we only learned very recently that because hormones are different, they therefore have different effects in the body, different risk profiles. So now we talk about the body identical hormones as being sort of the preferential choice because they carry different risks to the older synthetic hormones. And further to that, we're really understanding in the world of hormone replacement, for most women, most of the time, the benefits to health are far going to outweigh the little risks, which is just tremendous because, never mind just how we feel in terms of the hot flushes or mood or sleep disturbance, which we don't have to sort of struggle with. There's a great example of how, estradiol can be protective to the heart and the arteries and keep them elastic. Bone health, bone density, but not just bones. We talk about bones and osteoporosis, but joints, ligaments, osteoarthritis, dental health, eye health, like things that we don't necessarily connect. Hormones play a role from head to toe. So replacing them can have a profound impact on a woman's life. And again, we go back to explaining the term functional medicine. Think about how you function in your life, meaning how do you show up? What is your state of mind? Are you crippled by anxiety? Can you move your body? What is your mobility? Can you walk easily? Can you play the paddle that's important to you? That's about function. It's not about disease. And it's just as important to have that unbelievable functional capacity to enjoy life. That's what it's about. We're here to enjoy it.
Finding the joy in life and
Absolutely.
not waking up feeling absolutely exhausted.
Absolutely. Absolutely.
So you've told us then more or less how you manage the patients with perimenopause, menopause, and hormone imbalances within your center. Then you obviously do replace those missing hormones.
Well, it's not a stock standard answer. So we would evaluate every single woman, and based on her particular medical history, we would apply whatever solution is the most appropriate. So hormone replacement may be one, and there's some instances where women cannot use hormone replacement. Perhaps there's a history of breast cancer. So we would need to offer alternatives. And that is the point. We're solutions driven, and we want to be able to offer options that suit the needs of the individual in a way that is scientifically responsible.
Yes, and there are options.
Yes, absolutely. Let's understand that. Definitely. Yes. Many options. Absolutely.
But you do avail yourselves of those options, because life can be joyful after 50, after 60, and we're living to 100. So you want to be able to move with joy, to live your life, to be, you still have that mental sort of thing. Oh, I'm still 30, you know.
Absolutely. I think midlife for women is the most gorgeous, juicy, amazing time if we allow it to be. So yeah, we're faced with challenges, but the messaging is those challenges are not, we don't have to suffer and sort of sit back and be taken on the ride of accelerated aging, inflammation, hormone decline. We can be very proactive, and it changes the journey completely. And I see this every day. I see women who are in beautiful physiological balance, and they are thriving. They feel vital. They're sparkling. And it's just gorgeous to see because, of course, at this point in life, we've gleaned and garnered all this beautiful wisdom. So it can just be a magnificent chapter in life. And I'd love that it to be like that for every single midlife woman.
For every woman out there. All right. Well, I have one last question, and I have to. It involves the IV therapy trend. It is very popular. There are IV bars appearing in many urban areas. Your center offers this practice, but it's medically supervised, it's individualized. Why is the level of clinical oversight so important, Doctor, particularly when we compare it to these commercial IV bars in shopping malls?
Absolutely. I'm hugely concerned about these IV bars that are not correctly medically supervised. An infusion, an intravenous infusion, is a medical procedure, and it carries with it potentially huge risks of complications, catastrophic, potentially life-threatening complications. And for this reason, it should be taken absolutely seriously, and it should always be under proper bona fide medical supervision. It's essential.
And it's not to say that therapists haven't been trained in those centers, but there is actually no doctor on the premises. And for me, that's scary.
Agree. I absolutely agree. It's a medical procedure. It must be supervised and monitored by bona fide medical personnel. Basic training, therapeutic training would not be enough, in my opinion. So I'd love to see a shift in that.
All right. And then to close, where do you see the future of functional and preventative medicine heading? And how do you see your practice evolving within that space?
So I think we are just gaining huge grounds in terms of our knowledge and understanding and the advances in technology and bringing in AI. So I think we're going to see a huge acceleration and advance. In the course of my career, I've been, again, privileged just to see how, when I started, how preventative medicine and integrative medicine was really quite shunned, to today, where it's really embraced, celebrated, and the framework is really valued as a health tool. So I'm so excited to see how that develops further and further. I think we're going to have a number of significant scientific advances, and I think in this way our testing will get better and better and more precise. I think we will be talking more about precision medicine and personalized medicine rather than functional medicine. And our practice just has the incredible practitioners here. I must say, they inspire me every day. They are just so thirsty and curious, and they just don't stop reading and discussing. We meet every week. We share ideas because we have to evolve, and we want to. We just light up with the knowledge. So that seeking of knowledge is just beautiful.
And it's solutions driven, as you said.
Absolutely.
So
Absolutely.
thank you for
Absolutely.
that. So it's clear that healthcare is evolving. It's shifting away from that reactive treatment toward a more personalized and preventative model that considers the body as an interconnected system. Dr. Silver, thank you so much for sharing those insights with us. And to the viewers, as always, thank you for watching.